Welcome back to the news at 9 and today's HealthYes with Genesee Health Plan. We're talking about the history of the health plan and its impact on the community. So joining me now is Jim Milanowski and Kay Dorr. Thank you both for being here. You know, we want to talk about, for those who don't know, what is the Genesee Health Plan?
Yeah, I thought it'd be good to come and talk about that because we do all these segments.
Right.
So we have been, since 2001, providing health care coverage to the uninsured in Genesee County. And it's not health insurance, it's not Medicaid, it's not a state program. We're a private nonprofit. And what we do is provide a health care coverage, basic health care coverage like doctor's visits, prescriptions, labs, x-rays, mental health, dental now, all these services that we've talked about on this show before. And we provide that to the uninsured people of Genesee County. They have to be a Genesee County resident, meet certain income guidelines, and show a proof of residency in who they are to be on the health plan.
Sure, sure. Now, tell me a little bit about how Genesee Health Plan got started.
Back in 2001, and prior to that, the Granholm administration came in, and one of their goals was to look at the uninsured, not only in Genesee County, but all statewide.
Right.
And there was probably close to 1 million people uninsured in the state of Michigan at that time. So the administration set up these county health plans throughout the state of Michigan, including one in Bay, one in Saginaw counties, that would provide this care for the uninsured. So we got started in 2001, and in 2006, in order to sustain ourselves and be able to provide this coverage, we had a millage pass, a health services millage that passed in Genesee County.
Right.
And that gives us the dollars to be able to provide this coverage that we provide for people.
Okay, you know, so I guess who provides oversight of the health plan?
Well, that's why I brought my boss here.
Your boss. Okay, so this is your boss.
Yes.
All right, Kay, go ahead.
Actually, I chair the board for GHP, and it's been a real pleasure. It's just a wonderful asset to our community. And there are a number of ways that we look at and make sure that our tax dollars are being spent in the way it should be. So every year there's an independent audit. Those audits have come back shining every single time, so that's good. In addition to that, we always have Jim, our CEO, come and report to both the Board of Health, of which I'm a member as well, and to the Genesee County Commissioners.
Okay.
So there are just lots of ways and lots of transparency,
a lot of
so
double
that
checking.
we know that every dollar is being spent in the way that it's supposed to.
You know, what was the impact of Obamacare on GHP?
It's really interesting because back before Obamacare, we used to have about 28,000 people that we covered. Then we spent about 1.5 years getting those folks into the Medicaid expansion called Healthy Michigan and into Obamacare. So we did about 15,000 of those enrollments with our members into healthcare.
Sure.
And so now what we do is we cover those who don't qualify for any of those, or maybe just recently lost a job or are working a job that doesn't have benefits, and we cover those people. And then we do so many other things, and you know, we've talked about those types of programs. So we kind of had to reinvent ourselves.
Right.
We still provide that coverage for people, but then we do other services that that help all the Genesee County residents.
Wonderful. Thank you both, Jim and Kay, for being here. If you want more information about today's topic, just log on to our Facebook page right after the news at 9. We'll be there live answering your questions.